Hello, and thank you so much for taking the time to join us here on Community 7 today. I'm Victoria Hill, the Public Information Officer for the City of Billings, and this is one episode in a series on public safety updates in the city. Now, back in November of 2021, the citizens of Billings approved the Public Safety Mill Levy, and because of that, there's additional resources in the works across the city with some departments and getting those resources out to the community that are very much needed. Well, today's focus is the Billings Fire Department, and today Chief Pepper Valdez joins us here on the set. Thank you for being here with us today.
Thanks for having me.
Of course, there's lots to talk about. There have been some big changes among the fire department, within the fire department. So let's first talk about the newest one, the Mobile Response Team, or MRT for short. And before we get into the details, let's kind of give a little bit of a backstory, share the basics. What is MRT? Who makes up the crew? And what kind of calls are they dispatched out for?
Absolutely. So the Mobile Response Team is a two-person team that has an officer on it and a paramedic. And the idea behind it is the majority of our calls are EMS, or emergency medical service. And what we found out is that we were quickly approaching 20,000 calls a year. And it was just unsustainable for our large engines to respond on every single one of those calls. And so the idea was to develop these teams to take the pressure off the engine crews. And so their main focus is medical, but they can respond to other types of calls if available. They're kind of the Swiss Army knife of our department. They can go on not only medical calls, but they can go on structure fires, hazardous material calls, rescues, extrications, service assists, so on and so forth. So.
Great. And how was it the city decided that an MRT is needed?
So what we actually did back in 2012, this is not new to us. We did try to implement this program 10 years ago, actually, and the issue with it was that it was a great concept, but they weren't staffed. And so the problem was they were stationed at stations 3 and 5 on our west end of town, and the officer of that station would have to make a decision whether they were going to take the engine or the squad. And what it did was it delayed our response time because equipment had to be switched over back and forth from unit to unit. Equipment was getting lost or left behind. And then what we also found out is they would get on scene. And because of the type of dispatching we were doing back then, they would be caught without the proper equipment, and we'd have to call for an engine anyway. Right. And so we're just basically recycling or renewing, doing the same program, same concept, but now they're staffed, and it's worth its weight so far.
Great to hear. And now that the MRT is in action, what kind of results are you seeing? It was, I think, December 1st, right? That
is
they
correct.
Rolled out?
Yes, yeah. That is correct. And so the statistics on that are staggering right off the bat. So we took a sample, a 2-week sample prior to starting these. And as you can see here, before we implemented the program, Engine 6, which is in our Heights area, basically is in charge of a very large geographical area, and are running about 2,700 calls a year, and roughly 33,000 people in population up there. They couldn't possibly cover it all, and so we were running engines 1 from downtown, engine 2 from the south side, and sometimes truck 1 from downtown would have to run up there to cover those calls to back them up. And you could see that was about 20% of the time. That's a large number. Right. And what people don't understand is what happens is someone's going to be without their first due engine because we have to move all the pieces towards that direction to backfill and cover. And so after we implemented the mobile response teams, you can see now that number is down to 8% when an out of area engine has to respond up there. The mobile response team is now hitting about 61% of those calls while keeping engine 6 at a higher rate of readiness.
That is amazing.
And also you can see the total call volume and average response times have decreased significantly as well. So we are just ecstatic about the the
Yeah.
numbers so far.
That's great. Great results being seen right away. So, give us an example. I think maybe a story or something people can relate to. Was there a situation, or has there been a situation where you're like, thank goodness this MRT is in place?
Absolutely. Again, hasn't been in service for very long, and we only have one. But what's interesting is it is based out of Station 6, but it is tasked with covering the east end of town. During the peak hours, it comes out of the Heights and moves around town as needed. Wherever the battalion chief needs it, that's where it gets deployed. But its home is in the Heights. It just so happened last week that we had a structure fire at a multifamily dwelling. The mobile response team was in-house at the time, and they were able to respond, all 5 personnel, to this structure fire. Why I say that's unique is because Engine 6 normally, when it has its own structure fire in the Heights, has to wait for backup to come from other areas of town, and it's a geographical issue for us. Because the mobile response team was there, we were able to have 2 people inside and 2 people outside, which is a standard for us for safety. And we were able to knock the fire down immediately and minimize quite a bit of damage. Another instance was Engine 5 on the west end had a structure fire that tied them up for about 4 hours. Moved the mobile response team to the west end, and they were actually able to pick up 4 calls while Engine 5 was handling the structure fire. So this thing is showing that it's worth.
That is exciting to hear. And you mentioned Station 6 and the Heights and it being a geographical decision. Can you explain that a little bit more for the reason why the Heights was chosen for the MRT's home?
Absolutely. So again, we had a study done back in 2018 through Emergency Services, and they basically stated that you would need a second unit up there because of the geographical challenge that I had alluded to earlier. Certain times of the day, it's difficult to get needed resources up that direction. So you have time and distance, which is our #1 enemy. Then you have what we call the funnel. As you go through the metro area, there's only one way in and one way out, and that takes time. And if you hit that at the wrong time of the day, it makes the situation even harder. And so it leaves 6 by themselves for quite some time. And that can be quite a challenge on those crews. And so the study said that you should probably have a second unit up there. And that is why we determined that because of density and because of geographical challenges, we wanted to place it up there to help out, and it's proving.
Yeah, that makes sense. And since we're seeing such good results with it so far, will there be another MRT roaming around soon? And if yes, then when can we expect that?
Absolutely. So a program like this takes a little while to get up and going. And so for a second unit, we'll probably start the interview process in January, so this next month. Then by the time we can get them onboarded, will probably be the end of March or the first part of April. It's about 12 weeks of training, so you're looking at about middle of summer that we'll have the second one up and going. And that one will be stationed at either Station 4, which is our Terry Park Fire Station, or 5 on 24th Street West to cover the west end. Same concept, they'll come out, rove all over town as needed during those peak hours, but they'll have a home for the rest of the time. So.
And we've been talking about this MRT. I think people maybe want a visual. What does this thing look like? And it might sound like a magical leprechaun right now because maybe people don't realize that it is the MRT out and about. And when we talk about this, I think of the word resourceful. Auto industry shortages are happening all across the U.S. and that also impacts city government. So what is the fire department doing right now to make sure the MRT is out there versus maybe waiting for a vehicle to arrive?
Absolutely. So just kind of backtrack a little bit. The whole reason behind this was to be smarter with our resource deployment.
Yeah.
And, not every call warrants a fire engine or a fire truck. And so we wanted to go with a smaller vehicle for efficiency purposes to save the wear and tear on a vehicle. And that's why we chose these style of vehicles. So when I said that we started the program in 2012, we had the vehicle you see on the left is the original Squad. And so we've decided to move to a smaller SUV type vehicle. And those should be in by about July. But thankfully, my boss, Chris Kukulski, wanted us to move forward even before we started to collect the tax money, because he wanted to follow through on his promise to the public. And so we started sooner. And it was a bit of a logistical and fiscal challenge to do that. And so what we decided to do is to break that up and do it in phases. And that's why you just have one out there right now, and we'll have the second one on in the summertime.
Great. And, while the MRTs are out and about, does that mean the other firefighters back at the station that are working on the engine, are they staying busy too? Is Billings to that point right now where the MRT can be out and the engine can be out and everyone's staying busy?
Absolutely. So, like I said, we're approaching about 20,000 calls annually. We've changed how we dispatch. We've gone to what's called a priority dispatch, and we'll be moving, in addition to that, a proximity type of a dispatch, which grabs the nearest unit. So it's important for people to understand that the mobile response team cannot possibly capture all those calls. We never expected it to do that. So you'll still see engines go to medical calls, and not only medical calls, but low acuity type medical calls. And so with that, you have training that they still have to do, and the beauty of these mobile response teams is oftentimes we have to have multiple company trainings or drills, and these will be able to keep them focused on the task at hand while they handle those other types of calls, so that we're not interrupted and get through that training without that interruption.
And a question that might come to mind, well, if these MRTs are out and about, is there still a need for ambulance service in Billings? Kind of explain what the difference is there between the MRT and an ambulance.
Absolutely. So we do not have transport capability, and that's where our partners come in. They still have advanced life support for our community. American Medical Response is our partner. We've had a partnership with them for about 3 decades now, actually. And this is simply to augment the system. They will continue to transport the patient to and from and inter-facility transfers and such, but we do not have that capability yet. If you think of it this way, this unit, while it doesn't fully replace what an engine can do and the capabilities of what a fire engine can do, it is kind of a substitute for that to keep those engines in-house and ready for the bigger or more labor-intensive type calls, while this can handle those medical calls.
Okay, well, Chief Valdez, we've spent the last 13 minutes talking about MRTs. Who would have known MRT is so interesting? So I want to shift now to another concept that we're going to see out and about on the streets sometime soon here, the Crisis Response Unit. So what is the difference between the CRU, or crew as we're calling it, and the MRT?
Absolutely. So two completely different focuses there. So the mobile response team is essentially to handle, its main focus is the general medical type calls, both low acuity and high acuity type calls. The crew, or crisis response unit, is tasked, it's more specific. It is tasked with mental health crisis and certain types of addictions. That crew will consist of a mental health professional and an EMT.
Okay.
Now that EMT is also specialized. They'll have to go through a rigorous training course to become certified in dealing with the mental health crises. De-escalation type techniques for this to handle the medical piece, while the mental health professional's role is to figure out and find more definitive care for these types of individuals. We do have a certain type of demographic in our community that unfortunately abuses the 911 system, and we can now get them to more definitive care, find the right track for them, and hopefully reduce how often they use the system.
And that's great to hear that and I'm not just saying that because I work for the city, but great to hear that we are taking mental health very seriously, and we're doing something about it to help those individuals. And you mentioned the recruits that graduated in late 2022, and you have another class that you're looking to start up here soon, but will they be part of the MRT and the crew, those recruits that just graduated this past November?
Absolutely. So they will be qualified to be on engines, trucks, and mobile response teams. They will not be qualified to be on crew.
Okay.
As I had mentioned earlier, crew is more specific,
Yeah.
and these people are specialized in mental health. And what's unique about that is, again, we're talking about efficiency so that engines don't have to respond to every single one of those calls. But it also helps our police department, as they'll respond to every single type of these calls, they'll be able to get put back into the system much
Right.
quicker. So instead of being on a call for 15, 30 minutes or even an hour, once it's deemed that the scene is safe, they'll be able to get kicked back out into the system right away.
Great. And something else that you mentioned earlier about the safety levy that was passed. The money wasn't collected right away. So let's start talking about that now as far as collecting the funds. Passed in November of 2021, but here we are, end of 2022, going into 23, and the city's just now starting to collect those funds.
Yes, and that's what I had mentioned earlier about phasing this in.
Yeah.
The direction was to start using the reserves to get these programs up and running. And so to minimize the impact on that, that's why we chose to phase this in for two reasons. One, obviously fiscal reasons. Two was we didn't want to overtax our training division, so we had to kind of ease that in. It's a lot to bring in. You're talking anywhere from 6 plus attrition. We had a large class of 11, and that's a lot for our training division. And we're looking at another large class in the spring as well, and that's why we phased it in.
Great. Let's talk also about how the public safety mill levy has been able to support some of the titles and roles within the fire department. Who are those folks, and what do they do within the department?
Perfect question. So our ask was roughly 1.5 million for the 2021 safety levy that got passed, and that consisted of 14 full-time employees. 10 of those employees were focused on the mobile response teams. One was the assistant chief of EMS to oversee that program. And what's unique about that program is they're between the EMS chief and the operations chief, they are tasked with crossing over, overseeing that system. So the EMS chief is responsible for overseeing the MRTs, the crew, and anything healthcare related. While the assistant chief of operations is tasked with how things are deployed. So they work hand in hand together to make sure that those two systems, the crew and the MRT systems, are working smoothly. Then you have the assistant training chief. The assistant training chief basically, while the primary role for that is training, the biggest portion of what they do is logistics. And simply by having an individual that basically oversees our procurement and maintenance of all of our equipment, it has saved us quite a bit of money.
Yeah.
Another position was deputy fire marshal. And so this individual works within our prevention division, and they focus on target hazards within our community and then community risk reduction, which is also paid off in spades. So as far as target hazards go, they're tasked with going out and hitting the high volume type of buildings, your hospitals, your big box stores, your Lowe's, your Costco's, things like that. Study those, make sure that they're in compliance, and then they bring that intel back to us. And then we are more prepared to mitigate any problems should anything happen in those large facilities. So that's been a great addition as well. One thing that's not mentioned in here is the 14th position. And what's unique about this one is it's called the fire protection engineer. This individual is an actual engineer, highly skilled and highly trained. And why it's unique is the theory behind it is they're self-funded or self-sustainable through fees that are charged for their services. And basically they are tasked with plans reviews and studying fire protection systems within these larger buildings that I had just mentioned. And so we're really excited because that's new to us, and it's actually new in the state of Montana to have one in-house. And they'll work hand in hand with our building department.
Great, and that sounds like a great preventative method going forward. And it is interesting and an important point to make too that the deputy fire marshal isn't just investigating fires; they're also going out to prevent them also. And firefighters don't just fight fires; they're also EMTs, and some are paramedics, and they're looking out for the medical health of our community as well. All these positions are being added to the fire department. The people are growing; the number of people is growing. But how about facilities and buildings? We recently heard that the fire department's getting another station. Tell us about that.
Yeah, so we had, well, before that, we had 7 fire stations, our 911 center, and a training facility, and then also a maintenance facility. And so we were tasked with, from that study, original study back in 2018, they said if you're going to do another fire station, a second one needs to be placed in the Heights. And so we were tasked with finding property for the future building of 8th Fire Station. Well, sometimes it's better to be lucky than good. It just so happens that the individual that owned the fire station that we owned back 35 years ago was ready to sell. We got that information. We decided to take a look at it. It was in pristine condition. It was ready to be recommissioned and put back into service. And so we were just excited that this just fell into our laps, because basically what it has done is at a fraction of the cost, it has saved the city quite a bit of money to not have to purchase property,
Right.
get architectural and design fees added to it, and then the build process. So this is ready-made. Essentially, we're just doing some basic remodel on it. And Fire Station 8 is now on Lake Elmo in Hanson. And we're hoping to have it operational with that MRT that we talked about earlier by August, or end of summer, early fall. It won't be fully operational with an engine crew, but we can at least have it open, and it helps us strategically as well to have something placed in there. Again, we're just ecstatic to have it, because this was a gift to be able to move forward like this, like I said, at a fraction of the cost.
Yeah, talk about luck there. And you mentioned that August is when maybe the MRT can move in. Explain to the folks watching at home maybe why the new station can't just be fully staffed once the building's up and ready to go.
Yeah, so the biggest piece, I'm not going to say the easiest piece, but your one-time costs, your capital expenses, such as building a fire station or purchasing an apparatus, big money up front, but generally one-time costs over a long period of time. The most expensive piece are people, and so being able to staff with a full crew is going to take a little bit more work on our part. So it's going to take some time. We'll get the mobile response teams up and running, and we'll take a look at that data 12 months, 18 months down the road and see how that has impacted us. And then we'll take another look and see if we're going to need to open and have a second engine in the Heights.
And this all comes back to the Center for Public Safety Management report that was provided to you. People might wonder, well, why is another station needed in the Heights? But the Heights has that density.
Yes,
right?
absolutely. Again, density and geographical issues, being able to have a backup. And we're growing, no question. We're growing to the northeast, we're growing around the airport, and then you take a look at the West End. It's exploding out there on what we call the Southwest Corridor. Sometimes I think it's a race to see who can build the fastest. We're exploding. And so we wanted to get ahead of it and start with the Heights first, and then hopefully look at the West End here in the near future. But yeah, the Heights was our main concern, like you said, density and geographical issues. It helps us. It helps the whole community, not just the Heights, because now we don't have to continue to move resources up that way. We can keep people in play.
Yeah. And tell us, what is it like for you to see the fire department going through all these changes? Is it an exciting time to be fire chief?
It absolutely is. I'll tell you why. We have phenomenal, highly educated, highly talented, a solid core of people, and we continue to find them and continue to add them into our department. So as a fire chief, and as a citizen within the city, it's very exciting. And to be able to grow with the community. And I'm going to retire in this community, and someday I might fall down and need to call 911 myself, and I want to make sure that we have top-notch and first-rate people that are responding to everybody, because that's what we all deserve.
Excellent. Well, I thank you so much for being here with us and taking the time to explain everything that we just went over. Again, the city is just very grateful that the community was able to get behind the public safety mill levy and support it. And like I mentioned earlier, it was approved in November of 2021, but there are many changes coming up and that we'll see along the way. I think we're kind of in that culture now where everything's so immediate anymore that people think that, it's going to be different the next day, as quick as the next day. But it's all a work in progress. So we're going to actually have more guests on coming up on Community 7. We're going to be talking to Tina Hoger with code enforcement, and we're also going to have Gina Dahl, the city attorney, also to hear how things are going and with her department, and of course Police Chief Rich St. John. I can't just have you and not Chief St. John,
Oh,
right?
come on.
Yeah, so and of course we can't forget the city administrator. So anyone watching at home, you will see these segments coming up on Community 7. Look out for them. All public safety updates, lots going on behind the scenes, things that you already see out there in the works on city streets. And we thank you again so much for your support and making the public safety mill levy a possibility. Well, Chief Valdez, thank you so much for being here with us today. And I want to thank everyone watching at home as well for joining us here today on Community 7. Thank you so much. Have a great day.